Welcome back to Knowledge Bites. Today we're delving into the history of one of the most important institutions in global health, the World Health Organization, or WHO. From its inception to its pivotal role in combating pandemics, the WHO has been at the forefront of efforts to improve public health worldwide. Join us as we explore the origins, milestones, and significant achievements of the World Health Organization. The idea for a global health organization can be traced back to the 19th century, when cholera epidemics ravaged Europe and Asia. In response, the first International Sanitary Conference was held in 1851 to address the spread of infectious diseases. However, it wasn't until after World War II that the concept of a unified global health organization truly began to take shape. In 1945, delegates from 50 countries met in San Francisco to form the United Nations. Recognizing the need for an international body to coordinate health activities, they proposed the creation of a specialized health agency. This led to the establishment of the World Health Organization on April 7, 1948, a date now celebrated annually as World Health Day. The WHO's initial years were focused on addressing urgent health issues and building the infrastructure necessary to support global health initiatives. One of its first major campaigns was the fight against malaria. In the 1950s, malaria was a major public health problem, especially in tropical regions. The WHO launched a global malaria eradication program, which, although it didn't fully eradicate the disease, significantly reduced its prevalence and laid the groundwork for future efforts. One of the WHO's most significant achievements came in the late 20th century, with the eradication of smallpox. Smallpox was a deadly disease that had plagued humanity for centuries. In 1967, the WHO launched an intensified global smallpox eradication campaign. Through widespread vaccination and surveillance, smallpox was declared eradicated in 1980, marking the first time in history that a disease had been completely eliminated. In the 1970s, the WHO expanded its focus to include primary health care, recognizing that health is influenced by a wide range of factors, including economic, social, and environmental conditions. This shift was epitomized by the Alma-Ata Declaration of 1978, which emphasized the importance of primary health care and called for health for all by the year 2000. The WHO also tackled other pressing health issues such as tuberculosis, leprosy, and polio. The Global Polio Eradication Initiative, launched in 1988, has brought the world closer than ever to eradicating polio. Through extensive vaccination campaigns, the number of polio cases has decreased by over 99%, and the disease is now endemic in only a few countries. The emergence of HIV/AIDS in the 1980s presented a new and unprecedented challenge for the WHO. The organization quickly mobilized to address the epidemic, establishing the Global Programme on AIDS in 1987. This program aimed to coordinate international efforts to prevent and control the spread of HIV, promote research and support those living with the virus. The WHO's efforts, in collaboration with other organizations and governments, have led to significant progress in the fight against HIV/AIDS. Antiretroviral therapy has transformed HIV from a fatal disease to a manageable chronic condition, and ongoing prevention efforts continue to reduce the number of new infections. In the 21st century, the WHO has faced numerous global health crises requiring swift and coordinated responses. The 2003 outbreak of severe acute respiratory syndrome, SARS, was one such challenge. The WHO played a critical role in containing the outbreak by issuing global alerts, providing technical guidance, and coordinating international efforts. The H1N1 influenza pandemic in 2009 was another major test for the WHO. The organization worked closely with countries and other partners to monitor the spread of the virus, provide up-to-date information, and support vaccine development and distribution. The Ebola outbreak in West Africa in 2014-2016 was one of the most severe public health emergencies in recent history. The WHO faced criticism for its initial response, but subsequently played a key role in coordinating international efforts to contain the outbreak, support affected countries, and develop vaccines and treatments. The COVID-19 pandemic, which began in late 2019, has been one of the greatest challenges the WHO has ever faced. The organization has been at the forefront of the global response, providing guidance on public health measures, supporting vaccine development and distribution, and coordinating international efforts to combat the virus. The WHO's role in the COVID-19 response has highlighted both the importance of global cooperation and the challenges faced by international health organizations in addressing complex and rapidly evolving crises. The pandemic has underscored the need for continued investment in global health infrastructure and preparedness. Throughout its history, the WHO has made significant strides in improving global health. Some of its notable achievements include the eradication of smallpox, significant progress toward polio eradication, advances in the fight against HIV/AIDS efforts to combat malaria, tuberculosis, and neglected tropical diseases. Promotion of primary healthcare and universal health coverage. Response to emerging health threats and pandemics. The WHO continues to work on a wide range of health issues, from non-communicable diseases like heart disease and diabetes to mental health, maternal and child health, and environmental health. The organization also focuses on strengthening health systems, promoting health equity, and supporting countries in achieving the Sustainable Development Goals. The history of the World Health Organization is a testament to the power of international cooperation in improving global health. From its early days fighting infectious diseases to its current role in addressing complex health challenges, the WHO has played a crucial role in shaping a healthier world. As we look to the future, the WHO's mission remains as important as ever: to promote health, keep the world safe, and serve the vulnerable. Thank you for joining us on this journey through the history of the World Health Organization. If you enjoyed this video, please like, share, and subscribe to our channel for more insightful content. See you next time.